Hello, my name is Melissa Gatton and I'm the Executive Director of St. Mary's Health Clinics. Even with the Affordable Care Act, thousands of people in the Twin Cities live without health care. Our clinic doors need to stay open to serve them. Over the last 22 years, St. Mary's Health Clinics has grown. The medical care we provide is more extensive, the needs of the individuals and families we serve is more complex, and our ministry has expanded. Together, we can serve our community. Thank you for your continued support of our mission and our ministry.
I work at one of the major hotels in the banquet industry. I'm what they refer to as a server. It's a union shop, so it's all based on hours. A lot of on-calls work at maybe 3, 4, 5, 6 different hotels, and that can compile into getting enough hours to get the union health package, but I'm not one of them. I had some really major health issues that were building up. I'm a marathon runner. I realized that I was getting diabetes. I had all the classic symptoms, the thirst, the frequent bathroom breaks, and fatigue. And so I knew what was going on with that, but this kind of came up, and 2 days later they said, we're dragging you in to see a doctor. We don't care if you've got insurance, you're in big trouble. And yes, I was. The doctor told me something's got to change here real quickly or you're going to lose your toes in probably about a month. I'm uninsured. These visits were relatively expensive, and I sold everything I had to help pay for the visits. I finally exhausted my resources. I finally exhausted things that I could sell, and I'm not only sick, I'm getting sicker. And luckily my friend Pete happened to call, asked me how I was doing. I told him, and he said, you need to call St. Mary's Health Clinics. So I did. One thing I remember from that first meeting was the doctor, after asking me, for an hour, asked me questions and examining me, said, we're going to find out what's wrong with you. And that was amazing because I'm getting scared now. And that was the first person who finally said, we are going to figure this out. Yuli, who I will never forget, came in to talk to me about very specific diabetes things. How's your diet? Are you still drinking pop? And the last question he asked me was, can I ask you about your mental health? And I said, I'm not doing good. I've got some daughters I don't want to be a burden to. I have daughters that I want to be around to help. And I'm in some pretty dark days here. Yuli hands me her personal cell phone and makes me promise that if I ever get that bad, 24/7, I call her first. Unbelievable. That's the kind of care I was getting from St. Mary's Health Clinic. Everything was about how can we help you? Let's not overlook anything. We're going to be extremely thorough, and we'll get you on MinCare. So great. So I came in actually about a week ago, and we sat down for about an hour, and now I'm on MinCare. This is a guy who would walk 50 feet to his mailbox and back, slower than a 90-year-old man, and I'd have to collapse on the couch pretty much for the rest of the day. That's where I was in July. Okay, I'm running again. It's March 2014. Okay, I owe all of this. I was in such a dark place. St. Mary's pulled me through the darkness, took care of what I needed to have taken care of, and I'm back. And my kids still have their dad.